or through a colleague, please feel free to join our community. We'll have this information again at the end of the webinar, but there's a QR code here on the screen. If you just kind of pull your phone up, what it will bring you to is actually a populating email for you to the subscription email address. So to join the community, you just send an email. You don't even need to really say anything to our subscribe email address. And so that's what you'll find at the QR code here. We'll also drop it in the chat in a few minutes. And again, like I said, we'll put it at the end. So we just wanted to thank you on behalf of the community practice for being here today. So before I go into the objectives and agenda for today's session, I'd love to hand it over to our colleague at USAID. And if you could turn to the next slide. Today we have with us Kevin Pills, who's a senior supply chain advisor at USAID. And we thought what better representative to have than somebody who's really kind of helping us bridge that gap between supply chain and family planning program implementation. So Kevin, I'll hand it over to you for a few minutes to welcome us. Thank you.
Great. Thanks so much, Megan. Hello and good morning or afternoon or evening to everyone. Yeah, I'd really like to thank the organizers for inviting me to be part of this and do this introduction, and thank everyone who's joined. Yeah, bridging the gap between FP services and supply chain has been a topic of concern for family planning programs, at least since I started in this field in 2006. In order to reduce unmet need for family planning and enable FP users to access their method of choice, we need to ensure that the supply chain is able to meet the needs of users. We now frequently talk about that as a patient-centered or client-centered supply chain. But for a long time, we've talked about, and many of you have heard the refrain, no product, no program. And that's really been a call to action since the early 2000s, and highlights that many health programs, including family planning, cannot be effectively delivered if the essential products are not available at the clinic for the service. Obviously, the FP consultation services are also essential for women and couples to access the best contraceptive method for their needs. A contraceptive vending machine could not provide the type of effective, FP consultation and services that we want. So it really is necessary to bring together the commodity with the service to meet the needs of FP users. As this audience likely knows, USAID has for a long time, worked at that nexus of supply chain and services for family planning. We started donating contraceptives as a critical component of family planning programs in 1968. And have been supporting supply chain and logistics technical assistance for family planning since the mid-'80s. And these remain not only key components of our FP programs, but really have become key features of other health programs that have since emerged. USAID was a key member in discussions in the early 2000s that developed concepts like contraceptive security or reproductive health commodity security, where the concept really is about tying together logistics and supply chain with services. It focuses on a client's ability to choose, obtain, and use the contraceptives and reproductive health supplies that they want. And while obtaining that contraceptive definitely depends heavily on the supply chain, the informed choice and the correct use and understanding of the use is obviously critically dependent on that service component. So we've worked on contraceptive security with UNFPA and really a wide array of partners. On several critical approaches that are still important today. One of those is what we once frequently referred to as contraceptive security committees, but now exist in a variety of forms of national committees that coordinate the supply chain work to ensure that they're meeting the needs of programs. We worked on a variety of contraceptive security assessments, tools, indicators, which are still utilized, and then of course, a lot of that work led to the Reproductive Health Supplies Coalition itself, which many of you are familiar with. So there has been, we've been working on this area for a long time, but it remains a priority. And today, while FP programs have advanced, contraceptive options have progressed, and the language has changed in many cases, that link is still a priority. And within USAID, within our family planning supply chain group, we define the last mile of the supply chain as one of our areas of technical priority. And that last mile is really the community or the clinic where those supplies and those services need to come together. So within that priority, we put a lot of focus on health workers at the clinical level and what they need in order to maintain that continuous supply of contraceptives and reproductive health supplies for the clients. So Some examples of what we're working on now, some ways that we're trying to address bridge this gap currently, include, for example, decision support tools, where we're really trying to reduce the logistics and supply chain workload on those clinical workers at the last mile, but still enable them to make data-informed decisions at that point of care. So, for example, using open source tools, using artificial intelligence to look at ways we can automate those decisions and have strong decisions, but at the same time, less burden on the health workers. We are working in support of social entrepreneurs that use innovative models for providing FP services and products. We've moved beyond FPs only coming through, clinics and pharmacies. There's e-commerce, there's telehealth, there's home delivery. And these different new models that are emerging need different types of supply chain approaches. So we're working with some of those innovators in terms of developing the right models, refining their processes and performance, and helping them to broaden the range of contraceptives and reproductive health supplies that they offer. And one that we're just starting now, but very excited about, is working in Kenya, which we'll talk a lot about today, on improving access to family planning in pastoralist populations, which have traditionally been underserved. So how do we modify the supply chain? Where do products need to be available in order to serve the needs of those pastoralist populations in the north of Kenya? So that's an area that we're just starting work in coordination between our Kenya mission and headquarters. So, my focus is really at the global level and working across countries, but really excited for the conversation today and hear about the local in-market perspectives that inSupply is going to bring to us and that the webinar will focus on. I'm definitely excited. I'm sure I'll learn a lot. I also just wanted to give a shout out to inSupply for the supply chain training that they provided related to this webinar. I hope participants were able to take advantage of that, and for those who haven't, definitely would strongly suggest you do so. So with that, I'll hand it back to you, Megan. Thanks so much.
Thanks so much, Kevin. I really appreciate that perspective. And yeah, Rebecca, if you could go to the next slide. Before we hand it over to our inSupply colleagues, we wanted to talk about our objectives and our agenda for today. So our hope today is that by the end of the webinar, all of you as participants will understand or maybe even evolve your understanding of supply chain principles, which will enable you to actively contribute to and benefit from discussions on supply chain concepts and their impact on family planning method choice within your context. So really trying to bring that bridge to life by the session that we've designed today. Specifically, we have 3 objectives. So we hope to have an introductory understanding of basic supply chain principles, an understanding of the Kenyan public and private sector family planning supply chains and the way that they're implementing that from a total market implementation approach, and also an opportunity to understand and interrogate some key insights and also propose collaborative strategies for overcoming challenges in traditional supply chain models. And on the next slide, you'll see the agenda, how we hope to achieve this. So over the 90 minutes today, you of course have already heard the opening remarks. You'll then hear a little bit about inSupply themselves from Laura. You'll get an overview of supply chains from Vincent. Then we'll have a panel discussion where we'll have a representative from the Ministry of Health in Kenya, Dr. Ndwiga, as well as someone from DKT International Kenya, Dr. Kathinji, before turning it over to Wanjiru for some key learnings and challenges, and then some closing remarks from inSupply and from the co-chairs. So with that, I'm actually going to hand it over to our inSupply colleagues, and I'll keep it brief, saying, Laura Nabwire is the Kenya practice lead for inSupply. Any of you who've been exposed to inSupply Health will know that they are incredibly impressive and probably the perfect group we could have identified to talk about bridging gaps, because they actually embody this, right? I think it's really impressive to hear them talk about the supply chain features and the implementation features like seamlessly. And I know I've just been really inspired when I walk away from one of their talks, and I'm hoping you all get the chance to feel the same way today. So Laura, I'll hand it over to you to talk about inSupply Health. Thank you.
Thank you, Megan, and thank you, Kevin. Rebecca, on the next slide, as we introduce who inSupply Health, who are we? We love to say that we co-create innovations for health. And on the next slide, we'll give a bit of who we are. We're an affiliate of JSI, we're a health advisory firm, and I could say maybe a one-stop shop on supply chain, market development partnerships. How do we enter markets? Supply chain we'll hear more about today, monitoring, learning, evaluation, and capacity building. We are stationed, or can I say we have offices in Kenya and Tanzania, and these are the other countries where we are going into. So speak to us on how we can even continue expanding, including putting in TA requests. Next slide, please. Now, we work across public and private sector. That's why we are uniquely positioned to even have Ministry of Health and private sector representatives in this call. Kevin said it, data used for decision making. How is that data being used, and how can this capacity and competency be built within the healthcare workforce? How can it be not a burden for this reporting to happen? So we consult and find ways in which we can be able to get efficient supply chains, ultimately for access to medicine, to product for clients, the person at the end of the supply chain. In the private sector, how do we bridge that gap? Public and private sector, what are those collaborations? What are those sweet points that we can take advantage of? New product introduction across the two. And how does a total market approach look like when we can look at the data and have actionable insights for organizations to move forward with? On the next slide, we'll talk a little bit about what's our approach exactly. Inefficiencies, poor performance, quality, affordability. When we think about those, and how do we relate them then to resilient supply chain? So we're trying to get a people-centered approach. We use human-centered techniques. We co-create with the partners we're working with. And yes, Kevin worked in the ASAL region. So we are able to, get the learnings from that to move it forward. So there's ownership and sustainability. So yes, the grant is done. What happens? For that to happen, we do adaptive learning. What have we learned? What do we keep updating as we move? Little updates based on user feedback that go a long way in fostering the success and ultimately the sustainability of solution. Always beginning with scale and sustainability from the start. How would this be a better approach now that inSupply has been there? So we want it to be, because inSupply was here, this and this has happened, and we are better because of that. Next slide, please. Now, based on what we'd like to discuss today, how we are bridging gaps and how supply chains could do this, how resilient supply chains and improvement in supply chains would do this, I'm going to welcome Vicent Manilizo. Vicent is our domain lead, senior advisor. He's based in Tanzania, and he's going to take us through the basics of supply chain 101. And indeed, we do have the learning package that's in there. Vicent, over to you, please.
Yeah, thank you very much, Laura. So as Laura just mentioned, it will be just basic because supply chain is broader, but context to this session will be getting ourselves acquainted to some basics. Next slide. So I'll be talking about what supply chain and what's logistics system, just how the two are distinct from each other. But overall, I'll take you through what do we achieve through having having a logistics system in place. And lastly, we'll talk about the key components. So supply chain basically entails movement of materials from where they are manufactured to the last mile where the consumer or the client sits or accesses service. It involves strategic processes and decisions that are meant to deliver goods to the last mile. On the other hand, logistics systems are a subset of the supply chain. These are activities or tactical and the operation things that are set in place to bring about efficiencies in the supply chain as part of ensuring that products are delivered to the last mile. Next slide. So logistics system, as I have highlighted, basically intends to paint a smiling face to the client, making sure that the supply chain operates in an efficient way to ensure that the needed commodities or products are available for the service provision. Taking in the context of family planning, which is a programmatic undertaking, you might do everything in place, do the training, prepare the infrastructure, but if you don't have the products in place, actually the execution of the service won't be there. Reiterating what Kevin said, customer in supply chain, we say no product, no program. So you need to have the programs, and the logistics systems are the ones that enhance the availability of product at the last mile. Taking an example of a restaurant, which is the simplest logistics system that we know. Most of you are beneficiaries of this logistics system. Taking an example, when you're planning to visit a restaurant, just to have maybe a cold Coke, just to quench your thirst. You are seated on the table and you make your order. Just to learn from the waitress that there's no cold Coke, you are forced to make another option or take another option. I feel like your face will change. All the appetite you have prepared before you come to the restaurant will go away, and you'll be forced to think around what you take in place of the cold Coke. So the same applies to our supply chains. When they fail to respond to the needs of the clients, actually the clients run out unsatisfied. Next slide. So when we talk about satisfying the client, actually we mean that logistics system focuses on achieving 6 key things, which we call 6 rights in a supply chain. The first is ensuring that what is required by the clients is what is in place, like bringing the right goods. And in order to ensure that there's continuum of service, where there is a need to ensure that the levels of the commodities or the products are matching the operations of the service at a particular point in time. That's where now we need to have the right quantities of the commodities to ensure that the service does not get interrupted. However, when we are talking about family planning and other products, they need to be used for treatment, or for our case now to prevent pregnancy for family planning, we need this commodity to be effective and potent. In order for the products to be effective, they need to be in good condition. They need to be kept in a way that they do not deteriorate and they are able to deliver what the result that they're intended for. So another thing that the logistics system should deliver is the right condition, which means the right quality of the product. But again, we don't intend to take contraceptive products to a church. We need them to be accessed through community pharmacies. We need them to be accessed through health facilities. So having products in the right place is one of the requirements that the logistics system should deliver in the system. But for continuum of service, again, we think of the list supplies. The list supplies from the supplier, again, to the service delivery point. There is a time implication. But again, there is what we call the lead time. The lead time is the time taken when an order has been placed to when the commodities have been supplied and are available for use. So we need to ensure that the logistics optimize the time taken for delivery in order to ensure that service and the commodities are always available to avoid interruption of services. And lastly, when we are talking about access, it also implies the affordability. So when we are designing our systems, we need to ensure that the operations, the executions, the distributions, the storage and the manufacturing process are that much optimized to ensure that they do not bring up the cost burden to the last client. So the right cost is something that is required to be delivered by the logistics system. Next slide. So over this time, experts in the supply chain have been thinking on how best they can explain and simplify how supply chain works, depicting the key components that form up the supply chain. So they came up with this pictorial presentation, which we normally call the logistics cycle. And on top of it is the customer. Everything that we do in the health supply chain, we think of our customer. We think of trying to make sure that our customer are satisfied. So we need to have a mechanism to identify which products that we need to put in the system based on various criteria: effectiveness, safety, accessibility, and the rest. But again, after identifying the products, we need to have a mechanism to ensure that we have the products over a particular period of time, like how much is needed. That's why we talk about quantification. After quantification, we talk about procurement, that's having now the commodities. And then next, we have to make sure that we maintain the levels within the system by having inventory strategies that will facilitate availability across the levels over the time. The distribution process and the warehousing ensures the potency of the products, and again, improves access. So we are thinking of ensuring that we have a robust distribution process that will ensure access to the clients, and also having multiple outlets where clients can access the service. Next slide. So the logistics cycle applies to both public and the private sector. So for private sector, mainly we have the mainstay, the central medical store supplying products to the health facility, where family planning clinics are there, where clients come for counseling and accessing products. So in this case, the flow is entirely based on one supplier. And when there is an interruption of the supply of one of the commodity, that's where now the choice of the product or the method is hampered. Like the client become forced to choose out of the available methods. Next slide. On the other hand, the private sector has multiple players, including importers, distributors, wholesalers, and the community farmers get the product from these wholesalers. For the case, in case one of the importer has a challenge in terms of supplying the key product that is mandated or given a market shareholder to supply, we can see that again, the client's choice is affected because the products will not be available. Therefore, the client will be reliant on what is available in the market. On the other hand, as compared to the public system, given the shortage of a product at one of the wholesaler, the private community farmers can access the other products from the rest of the wholesalers. And in that case, it won't be an issue as compared to when the importer lands short of the products, and therefore continuum service will go with an affected choice to the client. Next slide. So this is just a brief overview of what entails supply chain and the public and the private sector. But overall, the key issue under supply chain is the availability. So once the availability has been affected, it also has an implication on the choice of methods. Overall, having a robust supply chain will enable individuals to get all the products and therefore can be able to have a broader range of choices in terms of family planning products. So just to give you more insights of what supply chain means, we have just developed an e-learning package that you can just access through a JSI e-learning center. What you just need, you need to create an account through logging in the ELMI's JSI ELMI center with the link that has been shared here. I think we shall share these slides. And again, you need to create an account where a couple of details will be required, like the name, you have to create a password, your location, and the country. Once you have created your account, you'll be sent with an email with a link on how best you can access now the email. But otherwise, once you have created an account, you can also use the barcode here. You can scan and access, but you will be required to enter an enrollment key whenever you want to access any of the courses that has been uploaded in this platform. There are several modules. As you can see here, we have introduction to supply chain, data analytics, problem solving, and essential facilitation skills. But of important will be the introduction to supply chain. Most of you would love to hone your skills on these aspects. Otherwise, I would love to end it here and open it for any clarification or questions. Thank you.
Vincent, thank you, dialing in all the way from Dar es Salaam. As he said, the Q&A function is up. Please put in your questions. I'll request Rebecca to kindly, as we are monitoring the Q&A, we can put in the poll. Let's assess where we are now based on the introduction and what Vincent has taken us through. So we'll give it a few moments here to just have a look at how familiar are we now that we've heard about the basics, we've heard about some of the priorities of momentum and the work that inSupply is doing. How familiar are we with the core principles of supply chain management? Are we experts? Do we have no understanding? How do we rate availability of contraceptive methods where we are in our context? So just a few moments for each of the participants to answer to this question. This will go a long way in getting the COP to schedule even the next webinars and tailoring some of our learning packages as inSupply Health. What are some of the significant gaps or challenges we encounter in the supply of FP method choice? Which ones are those? Vincent took us through how when you get into a restaurant and you don't get your drink of choice, and maybe then you end up drinking water. What are those challenges that we see in our setting? And a good one here, have you completed the introduction supply chain course offered by inSupply Health? And if not, we have an opportunity to register. It's currently free. Okay, just a few more seconds here to look at the voting, and then Rebecca, you could show us what the results look like. Thank you. So here we go. I hope you can all see the screen, how familiar we have experts, we have intermediate and basic level. So we are at a good space to start off and to have this conversation. So maybe not only Q&A, we can also put in comments. What's our context like? Do we experience any of this? Availability of supply chain products. Out of the 44 responses, 21 have regular supply, 10 have steady supply, which is a plus. Then we have inconsistent supply. And why then is this the case? Data accuracy scoring very highly here. So data is for decision making, the coordination across public and private sectors. So that's a really good point, because in our panel discussion, we'll have a bit of intel into how we can make it work. 7 of the 42 who responded have started and completed the course. 35 have not. We have this opportunity here right now. We're going to transition into something interesting, introduction into some of the work that inSupply has done on the next slide. And then next one, please.
As we started working with the public sector, it became very apparent that the pharmacy channel offered a really important opportunity to increase access to family planning for young girls, for women of all ages. Because in Kenya, the pharmacy channel is the first point of contact for any. As a mother, I can tell you when my kids are sick, the first place I go is the pharmacy. And that's actually the case for many Kenyans. Before going to a doctor, to a hospital, they'll go to the pharmacy. And so many families and communities place a lot of trust in their pharmacist technologist at their local pharmacy. But this doesn't apply for reproductive health. This only applies for treating acute illnesses, for example. And we wanted to understand, in partnership with our donors, which is the Bill and Melinda Gates Foundation and the Ministry of Health, how can this channel become better, a better channel to serve women for their reproductive health needs. And by that, we're looking at family planning, we're looking at self-care, we're looking at a number of different products, not just one. But DMPA SC offered an entry point to looking at how we might shape, influence, and evolve the pharmacy channel, community pharmacies in particular, to better serve women in family planning and reproductive health and self-care.
Getting into the pharmacy channel, we are trying to see, can we unburden the public sector? So that is one of the areas, and unburden it in a sustainable way. Because pharmacies wear two hats, you know. They are healthcare providers first, and then they are also business women and businessmen. Now we want to see how that can be sustainable.
Thank you. With a bit of that
As
on
we start
what, thank you, Rebecca. We are getting into our panel discussion. What opportunities do you have for optimizing supply chains for FP method access? We are privileged to have two panelists seasoned in this space, private and public sector, who I'm going to introduce right now as they come on screen. Thank you, Dr. Githinji and Dr. Ndwiga as well. Next slide, please. So we have Dr. Albert Ndwiga, who works with the Ministry of Health. So he's the program manager, the Division of Reproductive, Maternal, Newborn, Child and Adolescent Health at the Ministry of Health. He holds a Master's of Pharmacy in Pharmacoepidemiology and Pharmacovigilance, in addition to his pharmacy degree. Dr. Ndwiga's commitment to capacity building and his reputation as a seasoned and public trainer makes him a real asset because of his hands-on involvement in moving this aspect forward. While Dr. Stephen Githinji has 20 years experience in his industry, he's currently the National Sales Manager at DKT International. He has worked across pharmaceutical organizations. Now he's working for DKT, a social marketing organization. His passion for health equity has led to very senior leadership roles where he has championed innovative solutions for this. So beyond his professional achievements, he's interested in community work and improvement of access and community standards. We are going to quickly dive into the questions for these panelists. And as we start, I may have given the introduction, however, I'd just like for Dr. Ndwiga to kindly come through and tell us, you know, what your scope of work entails, but more importantly, what does it mean to you to expand method choice through the supply chain? Dr. Ndwiga, please.
Yes, thank you very much, Laura. I hope you're able to hear me. My name is Albert. I work with the Ministry of Health as the manager for the Family Planning Program. And you've asked a very important question, what it means to me, because it is important it is understood what the program does. And the reason we exist is to ensure a diverse range of FP methods are available, equitable, and accessible to all the client community as I mean, their varied preferences. The goal is to strengthen the supply chain to support the mix of options that are there. And for that to happen, we have a lot of work that we do. We have a robust forecasting and supply planning teams that work at least twice a year. We have a functional logistics management information system which generates the data we use for decision making and improves visibility of family planning data in all sectors, and especially in the public sector. And this management system has with it incorporated the commodity early warning and alert system, which is able to tell us where there are problems in the supply chain, where there are glaring losses, for instance, where there are unusual negative adjustments, for instance, where expiries are expected because of reporting of the short expiry products. And that way we can make the decisions quickly. The logistic management information system also enabled us to make the supply chain a bit simpler by eliminating some of the unnecessary depots and stores to ensure that the products are delivered directly from the central warehouse to the health facilities. We are also involved in the procurement, distribution, and warehousing of family planning commodities and contraceptives. And we continually monitor the supply chain to ensure that any any alerts that are generated by the system are addressed in good time. We also have the Global Family Planning Visibility Access Network. Kenya has started using the premium version, and we are able to have global visibility of family planning commodities. And that has helped us make several decisions on what to procure and when to procure, depending on the information we get there. And that to me is what we exist to do. That is what it means to increase diversity of the FP methods available to our clients. And that is what I can say about that for now. Thank you very much.
Thank you, Dr. Ndwiga. So it's interesting, diverse FP methods available, equitable, accessible, LMIS with data points to help make this decision, and Kenya subscribing to the global FP van, which is and the premium version of this, that decisions on what to purchase, when to purchase based on the data points that we have. And then the elimination of unnecessary depots and stores. So those are some of the steps the Kenya Ministry of Health has taken to ensure access and to streamline the supply chains. Thank you, Dr. Ndwiga. Dr. Githinji, kindly, what does it mean to you to expand method choice through the supply chain?
Thank you, Laura. I don't know whether you wanted me to talk about what I do, or I can go straight to answer your question.
So yes, you can talk about what you do, and as you talk about what you do, more importantly, what does it mean to you, to DKT, to expand method choice through the supply chain?
Good, great. In terms of what I do, I would say we, as DKT, we work in the predominantly in the private sector, and we use commercial techniques to increase access and affordability of family planning commodities. And I would borrow from what Vincent was talking about, that my primary focus is to ensure that we have the right goods at the right quantities, right conditions, right place, and at the right time in terms of servicing the private sector, though on a need basis, we also service requests from public sector. Now, in terms of what it means to me to expand method choice, I would look at it in terms of, as an organization, we try to have a variety of methods, what has been referred to as having a broad range of contraceptive options available to the FP clients. And we do this by ensuring that we have right suppliers of quality commodities spread across the globe. And then one of my key roles and what I've done over time is designing a route to market that ensures that we're able to do last mile distribution, get the product to where the FP clients require them. And do this through partnership with distributors. The other critical thing in expanding method option is pricing. So it's important that we make sure that we manage our procuring, our processes such that we're able to get the product to the consumer at the most affordable price. And sometimes we have to leverage on funding from partners to ensure that we have the product as affordable, especially to the low socioeconomic group, as possible. The other key thing we do as DKT is to create awareness. We do this through different methods. We have we have campaigns using different media that speak to the clients, social media, outdoor advertising, and many other media that we use to inform the healthcare providers and consumers of our product. Last and very important is supporting capacity building, both in private sector and public sector. So through funding that we get from donors we work with, we are able to train both practitioners in public and private sector. I would say as much for now, Laura.
Thank you, Dr. Githinji. And it's quite interesting, and we can see that there are similarities between the public and the private or social marketing centers. While Githinji is applying commercial techniques to increase access, still the 6 rights playing, and in fact is talked through the logistics cycle. And then the right suppliers, the route to market to the last mile, willingness to pay, what pricing are we using, and the approach of public and private, but also a mix of funding and a commercial approach for capacity building and to raise awareness on these different ones. There clearly is a theme here. The client is at the center. All the approaches by the ministry and by the private sector have a client-centered approach. I'd like to take this back to Dr. Ndwiga. Doc, could you kindly elaborate on the role of the public sector? And you've already started speaking to some of this in optimizing FP supply chains and how this contributes to better access and method choice for users in Kenya.
Yeah, thank you again, once again, Laura, for that question. I think I should start by saying that it is very clear that the public sector alone cannot meet the needs of all the clients in Kenya. In fact, I'm not sure there is any country that can. And therefore, we need to collaborate in all the sectors to ensure that all the needs of the clients are met. But I would point a few things that we do in the public sector that affects all the market segments. And one of them is that we are responsible for policy and regulation in the reproductive health space. For instance, self-care would not have happened and self-injection would not happen in any sector without a clear guideline on how to go about it. We also developed an industry policy that will answer this in a policy. The choice of methods as well, they are in those guidelines. And we have a committee that is active in scanning the environment, both local and global, to see what other methods that can be added to the method mix we have, whether they are long-term reversible methods, whether they are short-term methods. we also set goals. It's our responsibility to, apparently when excuse me, could you lower your voices, please? Thank you. I'm sorry, I'm in an open office. And the people are very excited when I start speaking. They are making more noise than. We set goals for the nation, and in this case, we were responsible for setting the FP 2030 goals, what we want to achieve in FP for the next few years. And we came up with 8 goals that we are working hard to achieve. And for that, we have high impact practices that we are rolling out to ensure that those goals are met. And as I said, that we are still not resting because we know some of the methods we use may become obsolete with time as the population changes, becoming more youthful. And therefore, we may need to incorporate more methods in future. We also do coordination to align all the supply chains to the national goals. That is very important for us in the public sector. We advocate all the time for finance and resource allocation for activities that we do. We, of course, have said we do the warehousing distribution for as major segment of the family planning services, the commodities that are delivered in the country. Other than that, we're involved in capacity building of all the sectors. We have developed a course for commodity management, which we are rolling out. We also train the pharmacy channel. We have trained, and we are even developing programs for them to be able to improve FP commodity delivery in the pharmacy channel, and even exploring to see whether they are able to expand the methods they offer to include the long reversible methods in the future. Other than that, of course, we are involved in improving access. We're looking at, there are several communities in Kenya that are, of course, underserved. Huge segments, geographical segments in Kenya. Actually, about 70% of Kenyan land mass is occupied by underserved populations, pastoralists, groups. And it is our responsibility to ensure that the supply chains that are set up serve these people. And when it comes to issues of emergency, when there are humanitarian conditions which happen from time to time, unfortunately, of course, most of them seem to happen in those areas as well. It is our responsibility to ensure that the minimum initial service package is delivered to those places to ensure continuity of service. And we want to finish off with the issue of the total market approach strategy. And we are now in very advanced stage to ensure that every market segment plays its role, its work, it's enabled and strengthened. In fact, we are looking at how we can strengthen local manufacturing of some of the methods that are used to ensure that it is easier and cheaper to access family planning services. The collaboration that we are looking at in terms of the implementation of the total market approach strategy is such that we will have a commercial supply chain that is driven, demand-driven, and client-centered. And this will help us, of course, reduce the load that the public sector has to carry in provision of these essential services. So That, in a nutshell, is what the public sector is doing to ensure that the FP supply chain is sustained. Of course, there are challenges that we are facing, including domestic financing, including the capacity of the county governments to deliver services, including frequent industry action by the workers and health workers. But all in all, I think without the leadership of the public sector, specifically the Ministry of Health, it will be very difficult to run the supply chain. Thank you.
Thank you, Dr. Ndwiga. And you've ended where I actually wanted to begin, about the leadership that the Ministry of Health provides in this space, and how both public and private partnership is important. The part about the policy, the regulation, where these guidelines come from, and the goals, FP 2030 goals that have resulted in the 8 high impact practices, which we are all, as implementing partners and even as the private sector, seeking to see how we can plug in ultimately for the patient at the end of the supply chain. An interesting aspect is the new product introduction into innovations team and guidance that the Ministry of Health is providing. Dr. Ndwiga said, scanning the global environment, we are getting a younger population, so acknowledging that you may need new methods. The total market approach and the task shared, we are seeing even pharmacies then being trained and getting a framework in to ensure that they can offer family planning methods. Pastoralist discussion coming in again, and how can we tailor our supply chains for that and for emergency and humanitarian kind of settings. Dr. Girinji, I want to turn this to you, please. How do you leverage your experience and partnerships to ensure a reliable supply chain of family planning methods? And what role do private distributors play in the family planning supply chain in Kenya?
Thank you, Laura. I'll start by talking about the experience that comes into, that's required for us who are working in the private sector. And most important for us is to understand the market. And for us, understanding the market is to understand both the demand and the supply side of the supply side and the dynamics the dynamics thereof. And as private sector, a lot of times you think of the size of the market, the opportunities in the market, and how we can optimize on the same. We also ensure that we understand all the stakeholders, in this case, the family planning space, who are the key stakeholders that we need to work with. And very important is to understand the regulatory framework. If we want to introduce a new product, how much time will it take us to get the registration? Then if we are doing any promotion for awareness, what are the compliance requirements? Other aspects of experience is in forecasting to determine what Vincent was referring to as right quantities, what are the quantities we need to stock of the different commodities, which is again determined by demand and supply, because supply there will be other competitors who will be the market. And also that speaks into optimizing on inventory, because having too much carries a risk of tying down capital. Having too much could also mean a risk of expiries. So we also try to use our experience to ensure that we are focusing right and optimizing on inventory. And talking of inventory would mean ensuring sufficient buffer stock and have our procurement logistics process in place. Key to, again, what we do is it's on the supply side of things, is to ensure that we have partnership with the suppliers who have the capacity to give us the right quantities, to honor agreed lead times, to make sure that we have continuous supply to the market. In terms of partners, some of the key partners would work with would be suppliers who give us the product. We have the partners who do logistics for us, forwarding and clearing. Distribution partners are key to what we do. And other sector players and government and government agencies being a key partner that we collaborate with. Talking about the value that private distributors play in our business. Last mile distribution is critical to the conversation we are having today, and you find that the private distributors have a lot of them have capacity to do that, and this will be through either having a branch network across the country. I know, like, we have a wholesaler in this country who currently has almost 40 branches spread across all the big towns, all the big towns in Kenya. We have distributors who have wholesale outlets, again, spread across all the key regions. And the reason why we need to work with them is because we want them to distribute the family planning commodities. And they're also distributing other farmer and non-farmer products. So it lowers the cost of distribution when the family planning commodities are being added to other category of products that they are delivering to wholesalers, retailers, and even providers. And one interesting about, I always say, the advantage of private sector and what drives efficiencies and improve the service to the customers is competition. And an interesting I find when it comes to service is you find, like in Nairobi, if you have 10 wholesalers targeting the retailers, you find this wholesaler who will offer to deliver in 2 hours. You place your order in 2 hours, a rider will deliver the product to you. We'll have, surprisingly, we have a distribution partner who is based in Kisumu and can deliver to Mombasa. And if you place the order today in the morning, the next day in the morning, it's been couriered through G4S or another courier company, and you have the product. The other value that private distributors bring into the distribution is offering credit to the retailers and the providers. I always say they carry the risk on our behalf. They have the capacity to do the appraisal or credit appraisal of the different category of customers and be able to follow up and get their payment, and to some extent cushion themselves for any bad debts that do happen in course of doing business. I'll say as much for now, Rauna.
Stephen, thank you. Thank you for that. And you know, when you talk about the demand and supply side and all the balancing that is done from a private sector perspective, and Dr. Ndwiga talks about what, you know, from a countrywide perspective, we can see that there's opportunities for each of us to plug into each other. One of the challenges that Dr. Ndwiga put forth is the domestic financing, which is something that Kenya is working to achieve on this. And while you say how distributors are able to carry that risk, you know, the credit risk, and yet clients are able to get products. So for those who are willing and able to pay for that convenience, that can be achieved, and then we are able to see the unburdening of the public sector. Now, private distributors going to the last mile, training of health facilities, and what Dr. Ndwiga talked about in the pastoralist communities. How and where do our clients want to be served? We're able to assess that. Githinji, you talked about optimization of the market, looking at the regulatory framework before products are introduced, and just balancing the kind of inventory, which is similar. So for DKT as an organization, then for the Ministry of Health for all Kenyans. Our Q&A is really ripe, and I request for Dr. Ndwiga and Stephen to have a look at that and answer. And I say a big asante, thank you for joining us in this panel discussion. I'm going to request Rebecca to move us to the next slide, even as our panelists look into the Q&A to answer questions. Please get in there and give us your comments. What is the context in your area? And we can quickly pull up the poll for this section to see how does it look like for us as attendees here. Based on the discussions that we've had in this panel, what interventions do you think would most effectively address the gap? So we saw a little bit when after Vicent's presentation on basics of supply chain, and then what aspect of supply chain optimization was most relevant to the work that you do? The role of public sector, the coordination, the challenges, the expanding method mix, including innovative new methods. What is one key takeaway that you can get from the panel discussion on expanding access? And what aspects of the private sector role do we find impactful in improving access? So you've listened to the Kenyan context. What does it look like in your context? So just a minute for us to get this going, and then we can pull up the responses. Kindly get in here and let us hear from you on how it's going in your context. Thank you, Rebecca. If you can pull up the responses. All right. At 50% increased funding and resources, and it's one of the challenges Dr. Ndwiga brought up. So the resources could even be about the capacity. In Kenya, we have a devolved system, the capacity of the counties. There's better coordination with suppliers, improved forecast and inventory systems. Vicent, we can see that we are possibly going to get lots of people engaging in the learning package introduction to supply chain with this and reaching out a bit more. So what aspects of supply chain optimization is relevant? The coordination between public and private. In our context, the Ministry of Health, gives us direction, and we all plug in to meet, say, the high impact practices and to ensure that we're moving forward. And there's that openness. Dr. Ndwiga talked about FP 2030, talked about self-injection and self-care, talked about, task sharing and how we can move that forward. What is your takeaway? Again, leading cross-sector collaboration, the role of data-making, decision-making. We can see policy coming in here and the improved infrastructure. The public sector's role in optimizing data management has come in and forecasting. So Kenya is privileged to have premium access of the the global FP van, which is good for us, and data is for decision making. How can we do it in a bigger scale? And how can we apply this in our context? Thank you, Rebecca. We can move to the next slide, please. Let's have a look at what an implementing pharmacy in Kenya speaks to about the training that has been offered to them. So remember the training, the mandate is by the Ministry of Health of Kenya. This is a private sector pharmacy, which we have talked about. Please, Rebecca, next slide.
I wanted to be part of the team that will make sure women get access to quality family planning services at affordable rate, offered by right people at the right time and at the right place. Okay, the training came in handy because by that time I was offering FP services, but the injectable I wasn't very so sure of. After the training, I built that confidence. After the training, I learned about record keeping. After the training, I was trained on counseling my clients. After the training, I was also trained on how I can refer the clients who come to seek for services which I don't offer. You don't just tell them, I don't offer that. I refer them, and I also track, did they receive these services? Are they happy, or it didn't go well with them? The experience has been so good because it has given me ample time to interact with my clients. like know them one-on-one, discuss more issues relating to family planning. We talk, we interact. I've come to know the right methods to use in counseling my clients, the right methods to offer my clients, to counsel them on the side effects, on the benefits of the family planning. Then also I've come to learn that family planning or reproductive health is a health right which every woman needs to get, and they should not be option or bargain about this. So we need to give them the best. Initially, I didn't have a safe space at my place. Yes, I had a counseling room, a consultation room, but I didn't consider it as a safe place for FP services. But now I do. This has really helped me so much in handling FP issues, or generally, or even other clients who have some kind of privacy. So joining this study has really helped me a lot.
Excellent. Family planning is a health right. Give them the best. When I refer them, I follow up and track. Are they happy? Are they satisfied? We are really privileged to have Dorothy as participating in this webinar. Thank you, Dorothy, for giving your perspective and for joining us in this. So it is working and we can see it. Now, what is inSupply doing in this space? What are some of the learnings, challenges, and outcomes that we have come through? I'm very happy to introduce Wanjiro Munene. Wanjiro Munene is a senior advisor, market development and partnerships, and she'll walk us through some of the work we've done, the learnings, and take us to the next level. Wanjiro, over to you, please.
Great, thank you so much, Laura, and thanks to Dr. Ndwiga, Stevie, and on all the previous speakers that went before me. So as Laura has introduced, I'm Senior Advisor, Market Development and Partnership at inSupply Health, and also overseeing and managing several projects that are looking at increasing access to family planning for both private sector and public sector clients. The next slide, I'll just like to highlight, some of the critical levers that would also enable increased access. And we cannot speak about supply chain without considering the policy landscape and enabling environment, and also some of the critical enablers when it comes to expanding the channel. So as Laura mentioned earlier, we work both in private and public sector in terms of our implementation. And some of the key things that we do together with other implementing partners in the country is to support and coordinate an enabling policy environment so that clients can access family planning at the channel of their choice, but also more importantly, the method of their choice. If you look at this slide, it just highlights some of the policies that we've closely worked with the Kenya Ministry of Health in terms of developing and having them available, making them available, disseminating them, and also elements of building capacity for the different healthcare workers that are participating in increasing access for family planning. So one of the key ones in 2018, pharmacists and pharmaceutical technologies were able to get the agency to cancel family planning, but also provide short-term methods, including injectables. So that includes DMPAM and DMPAC. Besides that, even as a policy and the agency is provided, they needed to be skilled. They needed to be provided with the relevant competencies to be able to provide these services at the pharmacy level or through the community pharmacies. And so with other partners, of course, led by the Ministry of Health, we developed the pharmacists and pharmaceutical technologies training packages. And this, of course, is a 5-day training where pharmacists go through 3 intense theory learning in the classroom, as well as 2-day practicum. And there is continuous support through support supervision and mentorship, either through the nearby facility or with other trainer of trainers within their locality. Another thing that is important in terms of increasing access is also increasing the community health strategy channel. So community health workers, at least in 14 counties in Kenya, and I had Kevin mention at the beginning, have the agency to provide short-term methods, including injectables. And this has been made possible by also the ministry developing community-based distribution training packages. And this is just recognizing the population of healthcare workers to the client, and allowing community health workers to be able to fill in that gap or to meet the gap of healthcare workers, especially in the arid and semi-arid areas. Another channel that I think is important is also self-care. So with the DMPAC, which is the Sayana Press, clients are able to, first of all, be trained by healthcare workers on how to self-inject. And subsequently, they can purchase several units from the pharmacy channel, or they can also access several units from the public sector and continue providing, giving themselves the product at the comfort of, at the convenience of their homes, or at the convenience of any place they want to self-inject. So one of the key policies that the ministry has also developed is the arid self-care guideline, which is currently being disseminated. But beyond dissemination, it's also training both the healthcare worker to understand what self-care means, and so that the healthcare worker can also train the clients on how to self-inject. So several milestones have been achieved in terms of an enabling environment. And of course, the ministry has been very progressive in terms of that. In the next slide, I'd just like to highlight some of the projects that have enabled our support and we are implementing in terms of family planning, increasing access, increasing the choices in terms of where clients can access their family planning method choices. So we have the market test. Market test is specifically geared to enabling the pharmacy channel to provide injectables, but also to participate more in family planning counseling. And beyond counseling, for the long-term methods, they are adequately empowered to refer appropriately. With the optimizing pharmacy channel, it's also a private sector geared project, which is looking at unlocking some of the key challenges that we identified with the market test, which was the first project. And some of the key things that we are looking at is, for example, how do we, train, for example, all the pharmacies that want to participate in providing short-term methods, including injectables. So capacity building is an important enabler in terms of increasing access and enabling the pharmacists to participate in providing FP. Second thing is demand creation and also increasing awareness among clients, but also among the healthcare workers themselves. So there's a huge work that we are currently supporting in terms of disseminating some of the policies that I mentioned earlier, but also working with different partners in the ecosystem to increase awareness, both for the client and also for the pharmacies. The third project mainly works in both private and public sector, more so at a macro level. So more instrumental in, for example, developing some of the policies, the guidelines, and the curricula, basically supporting the ministry to set this up. Importantly also is to looking at data. So just monitoring the impact of some of the interventions, some of the activities that we are currently doing in the country, and monitoring how the success of the FP program, specifically looking at the DMPAC for self-injection. In the next slide, we just want to highlight some of the key challenges, or also some of the key enablers in terms of both the pharmacy being able to provide family planning at the pharmacy channel, but also what are the key value propositions for the clients to visit the pharmacy channel for their FP services. Just to give a quick snapshot of the client journey, but also the pharmacy journey. So for the pharmacist, as I mentioned, for them to be aware that they now have the agency to provide services, short-term methods, including injectables at the pharmacy channel. So we do this through engaging through the professional associations and disseminating some of these policies and guidelines. We also disseminate the guidelines, for example, in conferences, in different workshops where we have the healthcare workers gathered. Another thing that is important for the pharmacy is capacity building. So once they know that they're able to provide the services and they're able to, provide injectables at the pharmacy channel, we need to capacity build them, we need to train them, we need to support them through that journey until they have provider confidence to be able to counsel the client, and also being able to provide choice to the client so that they can choose. And if it's a method that the client can access to the pharmacy, they provide it, or they support to initiate, for example, self-injection. But if it's a method that is not available at the pharmacy channel, then they refer appropriately to the nearest facility, and just providing that linkage also with the nearby facilities. Another thing that is important for the pharmacists to continue providing FP services at the pharmacy channel, and it has already been intimated with the earlier speakers, is of course a consistent supply chain. If they know that the product is available, then of course they will initiate, they will talk about it with the client. But whenever they have challenges in accessing the commodity, then they have doubts, or they have they second guess in terms of which product to provide to the client. So it's important that the supply chain is secured so that they're able to provide all the method choices and the client can choose. And for example, if the client chooses long-acting methods, and they're able to be referred appropriately. Some of the challenges we've seen, of course, in providing care at the pharmacy channel is waste management. So that is also has come out very strongly. And it's just basically that traditionally, pharmacies have not managed that kind of waste in their community pharmacies, and we have to support them or speak to different stakeholders to be able to either collect waste or organize them to collect waste at the pharmacy channel. Another challenge, as I've mentioned, in Kenya, one of the key things that we've been really trying to unlock is a private sector channel. So we don't have an importer in the private sector. But as an implementing partner, we've been supporting by coordinating and linking the pharmacies to public sector, speaking, of course, to the ministry and also the national medical stores to be able to supply the private pharmacies with public sector commodity as we coordinate the implementation of our private sector channel. I think just to reiterate some of the things that have already been mentioned by Laura, when we're looking at last mile and more in the arid, semi-arid areas, I think it's interesting to note that as inSupply Health, we've also supported the ministry in terms of workflow commodity management of the electronic community health information system. And I think that will be very key in giving agency to community health workers to manage also FP commodities at the community level. Besides that, it's of course supporting them also to be able to train them using the community-based distributor curricula so that they're able to provide the short-term methods where they have been approved to provide. So thank you, and I hand it back to Laura.
Wanjiru, thank you for that section. One of the things that's coming through from Kevin's opening remarks, clients' ability to choose, obtain, have informed choice, ability to choose, obtain, and use, having informed choice and have understanding of use. Dr. Ndwiga came in and said diverse FP, available, equitable, accessible, mix of options. Dorothy, pharmacy practitioner, says FP is a health right. And here we are coming to say, then if I do not have that product, I need to refer. So the role of public and private sector, and Wanjiru has also mentioned it, if the method is not available within the private sector, we refer. When the method is not available within the public sector, we refer and seek to see that. This is really enhancing the method choice. And we are getting to a place where we are bridging the gap in Kenya. The public and private collaboration, the task sharing, the supply chain optimization that we can get and we can see from, this brief discussion is really clear on that. We have a very quick poll that Rebecca will kindly run as we wrap up. Q&A is still flowing. Please keep them coming. What are the key learnings can you take from Wanjiru's presentation? What can impact FP supply chains? she's talked to all these areas, the client perspective, and the client perspective has been there from the opening remarks till now. And to what extent do private or community pharmacies in your region impact FP supply chains? So that's one of the things that we are seeing here and we're benefiting from, even under the policy landscape, regulation, and good pharmaceutical practice led by the Ministry of Health. So what role do community pharmacies in your region play? And from a client's perspective, in the work you do, what do you think could be the greatest challenge affecting contraceptive method choice? 3 questions as we wind up. And in a minute, Rebecca can, pull up the poll. The Q&A is still going on. Please, let's get in there. I can see people even sharing their experiences. Someone from Yemen talking about their social marketing experience for 20 years. So this works. Rebecca, kindly show us what we are saying around inSupply experience. So here we go, policy landscape, task sharing, some of those that can contribute, and then client's perspective on purchasing power and influence. Dr. Githinji talked about last mile and how distributing FP with other pharma and non-pharma products reduces that cost. Distributors are really working and are innovative in delivery, even within 2 hours. The community pharmacies, 50% of us say they play a significant role, while 32%. So close to 82% of our attendees are speaking to the community pharmacy channel. So let's continue to learn from each other. From a client's perspective, what impacts method choice? Now, this is an interesting one, the quality of care and access to services. Quality of care, even on our end, is very important. So we're working with our regulators and with the Ministry of Health to roll this out and ensure that this is at the fore, both in the public and in the private sector. Next slide, please. Now, this one is just for us to have all of us going into the chat. I can see the chat is already getting active. What are the key takeaways in today's session? And we know we have French participants as well. So please, what are some of those key takeaways from today's session? Let's keep the chat going. We've seen how to join the COP. That's also an area we can continue to engage. We're going to give the inSupply contacts even as we go on. What are some of those key takeaways? And I'm going to read that. I can see one comment. Community pharmacy mostly contribute to emergency pills, condoms, and over-the-counter prescriptions, and oral contraceptive pills. And we have a question here from one of the participants, and I'll request Megan to have a look at this. The COP password, community pharmacies, what they contribute to. So all responses, please, in the chat, let's get them going. We are monitoring and we will see them. Next slide, please, Rebecca. Another call to action. Scan the QR code. Let us know if you've signed up for this, and you can contact us at info@insupplyhealth.com. I'd like to say a very big thank you from inSupply Health as I hand it over to Rebecca and Megan. Thank you, COP, for this opportunity.
And thank you so much, Laura, and our inSupply colleagues and our colleagues from USAID as well, and from the Ministry of Health and DKT for the fantastic conversation. We have really spanned a lot of topics here. We've talked about capacity, we've talked about public and private sector engagement, we've talked about access, affordability, putting clients at the center, referrals. So this has been a very, very interesting conversation, lots of chat, lots of attendees as well. We have a QR code. If you have not joined the community of practice, please do. Again, you can just send an email and you don't have to say very much. You will be on the listserv. So I will just say thank you again to our wonderful participants. Thank you all for attending. And we will be sending out information, including the slides from this session. Everyone have a great rest of the day. Thanks.
Thank you.